Good morning once again. Welcome to my very first, or actually second show on this January 31st of 2018 to From the Heart, and not just any heart, my heart, featuring none other than the Juan-and-Only. And of course, I am Juan, and I have a very special guest here today on From the Heart. So on that note, I'd like to go right into our program here, and my very special guest today for show number 2 is Mr. Herbie Cruz. And don't worry, ladies and gentlemen, it's only a dummy, okay? Because I can do this. Because if it was a real person, I couldn't do this, all right? Because that person might be getting up and doing it to me, so we can't do that. So Herbie Cruz, thank you for being our guest here on From the Heart. And so you are a specialist in CPR, right?
CPR. I've been
of course.
Heart Association instructor for over 25 years.
For over 25 years, huh?
Yeah. First of all, I'd like to thank you for allowing me the opportunity to come in and provide some CPR training. Obviously, it's best for your audience members to take a certified CPR class, first aid class, AED class. Something that you learn in those classes can really save somebody's life. Something as simple as calling 911 or just doing compressions or knowing how to use a defibrillator can make all the difference in the world.
What made you decide to get into or become an instructor and so forth?
Well, a little bit about my background. After 28 years, I retired from the Chicago Fire Department. And during my tour, 28 years on the fire department, I became an instructor, American Heart Association instructor. So early in my career, we used to get a lot of calls from different organizations, nurses, healthcare providers, clinics, folks needing CPR. So I decided to become an instructor. And in 2014, I retired and established Cardiotech, a safety training company, and I'm doing this full time. I'm also, I work for NIPSCO. I am the public safety trainer in Indiana for NIPSCO. More specifically, I provide natural gas safety training for fire departments in Indiana. So again, early in my career, I decided to do this, and after I retired, I decided to do this full time because I just love it. I love going in and providing safety training and teaching people how to save lives, and we have an interactive class, we have a great class, and we have a lot of fun during our training. As you all know, you took the training over at the county building, so just really excited to do this.
Well, thank you, Herbie. So in a sense, you're retired, but you're not really retired, more or less. So, you know what, and congratulations on your new job with NIPSCO.
Thank you very much.
And how's that been real quickly, and how long have you been on your new job?
Well, I just started about 30 days ago, and I haven't actually started providing natural gas safety training as of yet. Still putting the program together, the demonstration, and just putting all the program together, and going to implement the program here within the next 30 days to the fire departments.
How long is the program to be certified in CPR?
Program takes approximately 2.5 to 3 hours for the healthcare provider for the Heart Saver class. Healthcare provider a little bit longer. American Heart Association offers 2 levels of training. The healthcare provider, which again is for anybody in the healthcare field, doctors, paramedics, nurses, and the Heart Saver class, which is what we're going to talk about today, which is for the general public. Just real important information that you should know. If you come across a situation where your patient doesn't have a pulse and is not breathing, just life-saving measures that you can take to help save that individual's life.
Let me ask you this. In all the time that you've been doing it outside of, after you retired from the fire department, have you had an actual real-life situation where you had to provide CPR to anyone?
I have not. All my saves, if you will, were while I was on the fire department. I've worked for various ambulance services, and out at U.S. Steel, I worked out in the ambulance at U.S. Steel. So I've performed CPR probably 100 times within my career, but not since I've retired where I actually had to jump in and provide CPR training.
Let me ask you this real quickly. As a fireman, then, the very first time you actually went out, whether it was in training or not, do you remember that day?
I do very
Tell us a little bit
very
about that.
clearly as well. I was probably on department maybe 30 days, and those familiar with East Chicago, right on the corner of what is that, 142nd and Euclid, there was a Helen's Laundry. Right next door to Helen's Laundry, there was a home where there was a 92-year-old lady that was in full arrest. I came in and, you know, I was all pumped up and started compressions. First compressions, what do you think happened?
I don't know.
Broke her ribs.
Broke her ribs.
Broke her ribs. But that's typical with an elderly patient. But we continued, and she survived for several days. But I was happy that at least we were able to respond, and she made it to the hospital and survived several days. And she passed away. You know, I kept track of that. You know, my first CPR incident, I kept track of that. And unfortunately, she passed away several days later. But it was very, very exciting.
Okay, that's great. So we are going to be having some demonstrations here as part of our program here today with Mr. Herbie Cruz, and do as much as we can within the 30 minutes that From the Heart is today. And so we'll provide very good information that will be provided by an expert in CPR. What does CPR stand for?
Cardiopulmonary resuscitation. Let me just talk about that briefly. A lot of people aren't a little confused about that cardio. First of all, when you hear the word cardio, what does that refer to?
Heart.
That refers to the heart. What else?
Blood.
The blood, that's exactly right. And obviously the blood vessels that carry the heart, the blood throughout the body, which are your veins and your arteries. Pulmonary, or in Spanish, pulmones.
Your lungs.
Your lungs, that's exactly right. Also the trachea, which is the pipe that brings air down into your lungs. And resuscitation, what does it mean to resuscitate? To revive, to bring back to life. How do we do this? Very simply, compressions and ventilations, because that's basically all CPR is. Compressions pushing down on the chest, ventilations breathing into a person's mouth. Compressions are important because what that does is every time you provide a compression, first of all, if you're providing a compression, what type of surface should be underneath your patient? Do you remember that one?
A hard surface?
A hard, flat, even surface, very good. So you kneel astride your patient, and with the heel of your hand on the lower half of the sternum, which is also called your breastbone, you put the heel of your hand down, one hand down, the other hand on top, and you provide chest compressions for an adult. And we're just going to talk about adult today. There are 3 levels of training for the American Heart Association: adult, child, and infant. And we'll just cover adult today. So you're going to push down a minimum of 2 inches to almost 2.5 inches, 2.4 inches. And the purpose of compressions is to circulate the blood throughout the body, and that's very, very important. You need to get oxygenated blood to the brain and to the heart, because if not, what's going to happen to the cells in the brain and the heart?
They lose oxygen?
They lose oxygen and they die. And that happens in a very quick period of time. Let's talk about cellular death real quickly. You have clinical death and biological death. When a person first goes down, there's no pulse, no respirations. That person is considered to be clinically dead. But you have a little window before they're in biological death. Biological death is irreversible death. That means enough cells in the heart and the brain have died where you're not going to be able to resuscitate that person. Pretty much you're going to be burying that person or cremating that person or whatever your family rite is. But basically you have a little window. And in that window, that 3 to 5 minute window, if you can start compressions to get that blood circulating throughout the body and or defibrillation, hopefully shock the heart, bring it back into what we call normal sinus rhythm, hopefully your patient will recover, or at least you've done everything that you could humanly possible. And we have something called the chain of survival, and I don't want to get into that in great detail, but basically the quicker you can start this and call 911, the quicker the ambulance can arrive and get that person into advanced life support in an ER. So again, the reason you're doing compressions is to circulate the blood throughout the body. The reason you're providing ventilations is because oxygen is necessary to be pushed into the lungs. That way when the blood rushes through the lungs and the heart, the blood gets oxygenated. Now that you have oxygenated blood in the body, how do you circulate that oxygenated blood? By providing chest compressions.
Okay. And so you run into a situation. I know there's a process there. Explain that process.
It is. Let's kind of go through. Let's kind of go through a scenario. Let's just assume that we have an adult patient here.
Right.
And again, the American Heart Association breaks it up in 3 categories: adult, child, and infant. An adult is anybody puberty and over, probably 13 and over. Okay. A child is considered 1 through puberty, and an infant is from birth to age 1. So we're just going to deal with an adult situation here because we have time constraints. Obviously, we have 30 minutes or a lot less now. But first thing you want to do, once you come across any emergency, and it may be a family member, or it may be somebody at Jewel or at the bowling alley or whatever the case may be. You come across a situation, what's the first thing you should do when you come across an emergency situation? Do you remember that?
Check out your surroundings.
That's exactly right. Very good, Juan. You want to check out your surroundings because you may be in an environment that's dangerous. Last 8 years of my career in the fire department, I was emergency management director and 911 communications director. And I remember one call very specifically where a dispatcher ran in and says, Herbie, you have to listen to this. So I run into the communications room, and over on Guthrie Street in East Chicago, there was a young man that dropped his buddy off, went into the apartment. He went to park. When he comes back into the apartment, his buddy had a knife sticking out of him. So all of a sudden you hear all this cussing going on, and what happened was there was a guy robbing his place when he walked in. And after this cussing, he ran out, the robber, if you will, ran out. The guy survived, but that's a perfect example of when you need to check out a situation, check out an environment, especially if it's a dangerous environment, because you never know. And in emergencies, unfortunately, people tend to have what? What do they have? They have tunnel vision. There's the emergency. Let me take care of that emergency. We, as American Heart Association instructors, are asking you to take a step back, look at the big picture, and then proceed with caution. So the first thing we always want to do is make sure that the scene is safe. After we determine that the scene is safe, next we want to concentrate on who? On our patient. So as we're walking towards our patient, we're looking for what? Signs of?
Breathing.
Signs of life, which is breathing, coughing, moving, blinking. All these are signs of life. This is an indication if your patient is living or not. So as we're walking towards our patient, we're looking for signs of life. But some people may be drunk, maybe sleeping, maybe their chest doesn't go up and down profoundly. So when you get to your patient, the next thing you should do is what? Shake and shout. Shake and shout. If that person is still not responsive, immediately you should do what next?
Call 911?
You should call 911 as quickly as possible. I can't stress the importance of calling 911 as quickly as possible. Time is of the essence. Seconds matter. Brain cells and heart muscle cells are dying very, very rapidly. So the quicker you could call 911, the quicker the ambulance can arrive with our emergency equipment, with our
remove clothing from the patient's chest.
With our defibrillators, with our nasal and oral pharyngeals, with our epi to stimulate the heart, whatever we need. So again, I can't stress the importance of calling 911 as quickly as possible. Okay. Also, there's a huge emphasis this year from the American Heart Association to put your phone on speaker when you do call 911. You could have taken this class 10, 12, 15 times, and you feel you know it pretty well. But let's say it's a family member. Well, that's going to shake you up pretty badly. You may not remember anything. Everything that you've learned is out the window. Why? Because mom or dad or your child's sitting here dying. So the quicker you can put your phone on speaker, that dispatcher can walk you through the process. So that's what you should do at that point, put your phone on speaker.
Herbie, what is that device right there that you had pressed a little bit ago? No,
this is the defibrillator.
Okay.
Okay.
What is that?
This is an AED or automated external defibrillator. What this does basically is, first of all, you want to get to your patient as quickly as possible, because in sudden cardiac arrest, VFib or ventricular fibrillation is the most common, the most abnormal heart rhythm. So, and that's a shockable rhythm. So the quicker you can get this defibrillator to your patient and hook it onto your patient, the better chances of their survival. And as far as using this, is the simplest machine on God's green earth to use, because basically all you have to do is push the buttons, and it's going to walk you through the entire process.
All right, and on that note, Herbie, ladies and gentlemen, this is From the Heart, and we will be right back. Am I right? Welcome back to From the Heart, featuring none other than the Juan-and-Only. And we're actually talking to Herbie Cruz, who is a CPR specialist. And no, Herbie and I did not shrink. We're just on our knees. and let me also say this here, we were talking about a 911 situation in which Herbie was going through the process of that, and we'll just go ahead and take it from there.
Thank you. Again, we're going through the scenario, and we left off basically calling 911 and the importance of putting your phone on speaker. Again, CPR is very physically and mentally demanding. And again, mentally demanding, you might not remember any of your CPR steps. By putting your phone on speaker, dispatcher can walk you through the process. So after you've called 911 and put your phone on speaker, now you're ready to start CPR. If you don't have a AED available, and we'll talk about AED here in a few minutes. So next thing you need to do is you need to position yourself and the patient for CPR. As far as the patient goes, you need to make sure that the patient is on a hard, flat, even surface. So, hate to pick on grandma, but if you come home and grandma's on a couch or on a bed, what do you need to do to grandma, Juan?
Put her on the floor?
You need to get her down to the ground. That's exactly right. Now you're ready. So what you would do is you would kneel astride your patient's chest, and you're ready to start CPR. Now the ratio of compressions to ventilations for one rescuer adult is 30 compressions to 2 ventilations, and we're going to go through that process. So the first thing you would do is position.
Can I stop you real quick?
Sure.
Because I'm just thinking about this right now. Does it really matter, or maybe just on the individual, like the victim's right here, right now, facing with his or her head facing this way? Is there a better situation in dealing with a victim when it comes to CPR, whether like maybe on this side, or maybe it's better for me to get on that side and maybe have this person, you know what I'm saying?
Wherever you're most comfortable with.
That's what you.
And sometimes the situation will dictate where you need to be.
Okay.
So as long as you're comfortable, you're good, and as long as you're kneeling astride the patient's chest, you're good. Okay, so position most comfortable. So now we're ready to start compressions and ventilations. As far as compressions goes, as I stated earlier, we're going to compress on the lower half of the sternum, which is also known as the breastbone. So what you would do basically is with the heel of your hand, go directly to the lower half of the sternum, put one hand down and the other hand on top, and position your shoulders over this patient's chest. And what we want to do is we want to provide 30 compressions, hard and fast compressions, because if you calculate it, you want to provide at least 100 compressions per minute. So as you're kneeling astride your patient, again, you're going to provide 30 compressions. 1, 2, 3. Compress with me, Juan, would you? All right, ready? 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 22, 23, 24, 25, 26, 27, 28, 29, 30. And again, for an adult, you want to compress between 2 and 2.4 inches, almost 2.5 inches. Now that you've completed your 30 compressions, you want to slide up and you want to provide 2 ventilations. Now, American Heart Association recommendation is never, ever, ever put your lips on another patient's lips or on your patient's lips without using a barrier device. This is a nice thick barrier device, an OSHA-approved barrier device, and we all know who OSHA is, the Occupational Safety and Health Administration. They're the federal branch of the government that dictates safety policies for both public and private industry. Anywhere that you go to work, you have your OSHA standards. In the medical field, you have a nice thick mask, and this is the key element. This is a one-way check valve. This is going to allow you to provide ventilations in one direction, but if any air, vomitus, spit, mucus comes this way, there's a little check valve that closes off. So what you would do is, first of all, you want to open the airway before you put your mask on. The method to open the airway is called the head, tilt, chin, lift maneuver. Head, tilt, chin, lift. So basically, you put your palm on the forehead, 2 fingers under the bony part of the chin, and lift up. What that does, it pulls the tongue away from the trachea, allowing open access. That way, when you provide your ventilation, the air, which oxygen is in the air, goes directly into the lungs. So once you have your head, tilt, chin, lift maneuver, you want to use your mask. If you're using a mask, you've got a pointy part and a rounded part. The pointy part goes up towards the nose, and you create a good seal. Now you want to provide 2 ventilations. As far as the breaths go, they should only be about a second or a second and a half, because if you're providing breaths too quickly or too forcefully, all that excess air, initially the lungs are going to fill up, but that excess air is going to go down into your lungs, causing what we call gastric distension or gastric inflation. That's basically when the belly just blows up. We don't want that. So the breath, again, should be only about a second to a second and a half. And what's important to remember is just enough air to make the chest rise. So again, we have our barrier device, and again, the reason we're using a barrier device is to protect us from communicable diseases like HIV and hepatitis. So we provide our 2 breaths. See that chest go up? Okay. So we've provided 30 compressions and 2 ventilations. In other words, we've completed 1 cycle. The ratio of compressions to ventilations is 30:2 for 5 cycles or 2 minutes. 5 cycles will take you approximately 2 minutes. So we've just completed 1 cycle of 30:2. What do we need to do next one?
Do 30 more compressions.
Do 30 more compressions, another 30:2, that would be 2 cycles, 30:2, 3, 30:2, 4, 30:2, 5, and then again, that should take us approximately 2 minutes. So after 5 cycles or 2 minutes, what we want to do is we want to reassess the patient. We want to reassess, again, for signs of life. Are they breathing? Are they moving? Is their chest going up and down? Are they blinking? Any of these are signs of life. If at any time during CPR your patient recovers, and when I say recovers, doesn't mean that they're up and talking to you, simply means that they're breathing on their own. What you want to do with your patient is place them on their side. This is called the recovery position. You want to continue to monitor your patient, and if necessary, sweep out their mouth. So you want to make sure and have your proper PPE or personal protective equipment, which includes a barrier device and gloves. So you've completed 5 cycles, which took you approximately 2 minutes. What do you want to do after this? You want to reassess for signs of life. Still no signs of life. You want to continue on at what ratio?
30:2.
30:2 for 5 cycles or 2 minutes until help arrives or you're too exhausted to continue. This, as I stated earlier, very mentally and physically demanding. You may come across a situation where you're starting to get chest pains, you've exerted yourself, you're sweating like crazy. Well, if you feel that your health is being compromised, obviously take a step back, take a few seconds, and continue on if at all possible. The most important part is that, remember, you've called 911, so hopefully they'll be here very quickly.
So when 911 gets here, then what happens?
They take over patient care, period.
Okay, so they just tell you to step aside?
That's exactly what we'll do.
And then what do you need to do? You step
You
aside.
just step aside, and
Right.
if you have any information about this patient's health, it might be a family member. They're a diabetic, they've had open heart, they're asthmatic, whatever the case may be. If you have any history or any medications that that individual may be taking, you want to pass that information on to the medics when they arrive.
Okay. So once again, we were talking about the AED, and that's a tool used in helping resuscitate an individual, right?
Yeah, they call this an AED. I call it a miracle machine because it has saved so many lives. That's why you see them everywhere. You go to McDonald's, what do you see? An AED. You go to the library, you go to the airport. Everywhere you go, they have an AED. Here at the Hammond Area Career Center, right around the corner, we have an AED. So again, AEDs, what it does, it sends an electrical shock to the heart. A couple things you need to know. First of all, let me make one point about an AED and how important it is to get it to the patient as quickly as possible. Let's say you have an individual that you run into saying, I've got severe chest pain in the center of my chest. It's radiating to my shoulders, to my arms, to my leg. I'm sweating profusely. You're going to suspect what?
A heart attack?
A heart attack, that's exactly right. Or you see somebody that comes to you and says, well, I can't move on the left side. I don't have any power. Or you see their face has drooped to the left side. You're going to suspect a what?
I'm not sure.
Stroke?
Okay.
Stroke, right? Or maybe somebody with breathing difficulties. What's the common denominator with all these examples? Is that possibly this person's system is crashing. They may go into full arrest here very, very quickly. So I can't stress the importance of getting that defibrillator to your patient as quickly as possible. As far as the defibrillator itself goes, again, sends an electrical shock to the heart. There's a couple things that you need to know. First of all, let's say your patient is sweating profusely or in a swimming pool. They pull that patient out. I just told you that it sends an electrical shock to the heart. Do water and electricity mix?
No.
No, obviously not. So what should you do to the chest? You should dry it off as quickly as possible, okay? You may come across a situation where your patient has a pacemaker. You don't want to put the pads directly on the pacemaker. or a situation which is very popular now where your patient is wearing medicine patches on the upper part of their chest. You want to take the medicine patches off, dry off, and you're ready to go. So as long as that's been taken care of, or you may have a situation with all defibrillators, you're going to have a little jump kit. You may have a situation where your patient has a hairy chest. It's important that you make good connections with your pads. So what you want to do is you want to shave that area off as quickly as possible. Now you're ready to go. As far as using this machine, simplest machine on God's green earth to use, because all you have to do is press the button and it's going to walk you through the entire process. I tease my students, you could be brain dead at this point forward as long as you can follow a direction. And let's follow those directions. So I turn it on.
Remove clothing from the patient's chest.
Remove clothing from the patient's chest. So what I want to do is I want to totally expose the chest. Male, female, it doesn't matter. You have to totally expose the chest. A woman's wearing a bra, it may have an underwire. You don't want arcing, electrical arcing. You have to totally expose the chest. Okay? But at this point, depending on the situation, we want you to take charge of the situation. You may be at Target or whatever the case may be, out in the public, and you're going to expose a lady's chest. Obviously, you know, take charge of the situation. All right, everybody step back, assign somebody to call 911, somebody to get the AED, the whole 9 yards. So after you expose the chest, next thing it's going to tell you to do.
Remove clothing from the patient's chest. Open packet and apply pads onto patient's bare skin.
Open packet and apply pads to patient's bare skin. Well, where do you apply the pads? Doesn't get any simpler than picture, folks. Okay? Upper right, lower left part of the chest. So this is lower left. This is upper right. So what lies between those two pads, Juan?
Your middle of your chest and
Your heart.
Your
heart. So immediately, once you hook on that second pad, immediately it's going to start to pick up the heart rhythm. And I want to stress that rhythm. A lot of people feel that using a defibrillator you might hurt a person. Absolutely impossible. You can never hurt a person using a defibrillator because it will only work. This machine is so smart that it will only send enough energy in the form of joules, kind of like voltage, if the heart is in the right rhythm, in a shockable rhythm. So don't ever be scared to use a defibrillator. So once we've hooked on the pads,
Do not touch the patient.
don't touch the patient. If you touch the patient, it might pick up your heart rhythm.
Touch the patient.
Don't touch the patient.
Heart rhythm. Shock advised.
Shock advised.
Do not touch the patient.
And just a point,
Press the flashing shock button.
press
Press the shock button.
the
now.
shock button. Again, what that's going to do, it's going to send an electrical shock to the heart. So when I press that button, this is what you will see the patient do.
Begin CPR.
Now, defibrillation and CPR go hand in hand. So let's say we're doing 2 rescuer CPR, somebody commits to the head, somebody commits to the chest. You hear that counter? Get ready, hold the airway open there, Juan, please.
20. 30. Give 2 breaths.
Use your mask, please,
Okay.
and provide the 2 breaths. See the chest go up and down? Give a little harder breath. There's my counter.
10.
It even counts for you. Very, very simple to use. And this might be the difference between life and death.
30. Give 2 breaths.
Very good. And just continue to follow instructions. And again, what I recommend to all the audience members is to make sure and take a certified CPR class. Again, this is just a brief snapshot of what the class offers. Basic CPR. We also cover foreign body airway obstruction, conscious and unconscious. A lot of information, again, invaluable information that might save somebody's life.
So, you know what? Time has gone by, and it is time to wrap it up. Herbie, thank you very much for being our guest on
Thank you.
From the Heart, featuring the one and only. I do want to thank our production crew, Sabrina Velez, Samantha Diringer, Brandon Dananay, Haley Kramer, Tristian Celmer, and there may be others that are not on this list here, to our multimedia director, Stephanie Reiser. And From the Heart will be taped once a month, 2 30-minute shows on the same morning, and they will be seen on the Area Career Center's YouTube channel at ACC TV Hammond. So listen to WLTH AM 1370 radio Friday evenings from 5 to 6 and Saturday mornings from 10 to 11. And for more information about upcoming shows, and then when you can be able to view the shows from the heart. And you know what, ladies and gentlemen, not just any heart, my heart. So on that note, God bless you all, and stay tuned for more great programming from the heart. So thank you to the crew, thank you to everybody, and God bless you all.